Gildan Media presents Your Coach in a Box, affordable, life-changing audio programs.
Emotional First Aid. Practical strategies for treating failure, rejection, guilt, and other everyday psychological injuries. Guy Winch, Ph.D., Hudson Street Press. Introduction. Ask a 10-year-old what you should do if you catch a cold, and the child would immediately recommend getting into bed and drinking chicken soup. Ask what you should do if you get a cut on your knee, and the child would advocate cleaning it, or using antibacterial ointment and bandaging it. Children also know that if you break a bone in your leg, you need to get a cast on it so it mends correctly. If you then asked why these steps were necessary, they would tell you that treating such injuries helps them heal and prevents them from getting worse, that colds can turn into pneumonia, that cuts can become infected, and that if broken bones heal incorrectly, you'll have trouble walking once the cast comes off. We teach our children how to take care of their bodies from a very young age, and they usually learn such lessons well. But ask an adult what you should do to ease the sharp pain of rejection, the devastating ache of loneliness, or the bitter disappointment of failure, and the person would know little about how to treat these common psychological injuries. Ask what you should do to recover from low self-esteem or loss and trauma, and adults would be equally challenged. Ask how you might deal with intrusive ruminations or nagging guilt, and you are likely to be met with sheepish looks, feet shuffling, and a pointed effort to change the subject. Some might confidently suggest the best remedy is to talk about our feelings with friends or family members, certain that no mental health professional in his or her right mind would object to talking about feelings. But while discussing our feelings might offer relief in some situations, it can actually be damaging in others. Pointing out these dangers usually causes another round of sheepish looks, feet shuffling, and a pointed effort to change the subject. The reason we take little to no purposeful action to treat the psychological wounds we sustain in daily life is because we lack the tools with which to manage such experiences. True, we could seek the counsel of a mental health professional in such situations, but doing so is often impractical, as most of the psychological wounds we sustain in life are not serious.
Sample complete. Ready to continue?